Part 2. Psychologists. Most psychologists won't help you fix the brokenness around you or mollify your legitimate vexations. They're taught to fix you, the patient. If these supposed bastions of wisdom befriended and empathized with their patients, that camaraderie could buoy them up on a pearly pink bubble of positive energy. Some patients lack social skills or neglect their hygiene. Psychologists could help greatly by teaching and admonishing their patients in these areas. Instead, patients face belittlement. Numerous times I carefully explain myself to properly convey my problems with others and vent frustration. Instead of camaraderie or helpful solutions, I got responses like, maybe that's just your impression of things. That's offensive. I don't trip on hallucinogenic mushrooms or LSD or have a non-functioning brain. I'm an adult who thinks objectively. My impression of things is reality. Furthermore, all of creation is degenerate, which degeneracy manifests in selfishness. Selfishness leads to treating others like yourself with compassion and understanding. Outsiders get rejection. Atheistic psychologists view truth as the popular vote. They try to make patients conform. So outsiders who see psychologists get double rejection. Being happily married with children, having fulfilling jobs, and without mental handicaps, psychologists and psychiatrists can never empathize with disadvantaged patients. Instead, their success serves as advertisement to make disadvantaged patients mistakenly think that they can achieve the same success. For me, paying someone to talk to me would steal my dignity as paying a prostitute would. Furthermore, psychologists working with psychiatrists usually never find an end to the patient's sessions or a solution, often continuing the so-called treatment indefinitely. Asking irrelevant questions where it doesn't matter how they're answered, or asking tangential questions helps perpetuate this cycle. These professional talkers use probing questions to gather information and complete documented files, which may be only partially accurate, the other part constituting prejudicial impressions of the patient. Although confidentiality is usually respected, in my experience, besides my personal records becoming muddled with subjective negativity, gross errors occurred, such as typing that I had a tumor, a spelling error, instead of tutor, as in algebra tutor. Parents gossiping about their children to the psychologist poisons a relationship, rendering sessions with psychologists worthless. With my psychiatrist and parents in cahoots, neighbors, like I said, I was bullied into this garbage. My parents, they're a-holes. With my psychiatrist and parents in cahoots, neighbors and a landlord made up lies and slander, which contributed to misunderstanding with a psychologist. This persecution culminated in police officers armed with guns, tasers, and pepper spray invading my apartment, besides ambulance drivers. That this organization was crooked is known from their numerous bad reviews. They are documented as unable to properly diagnose patients, being extremely uncaring, unethically billing patients, and breaking confidentiality. When trigger-happy police were called for someone labeled disturbed and they felt threatened, even with only toy guns or knives, they riddled the person full of holes, disposing of him in a body bag. That's certainly a psychiatric prescription, but not to help. That's a prescription for death. A prime goal in warfare is hiding information from the enemy. Psychology is the opposite, giving as much information as you can and documenting it for total strangers who make money from you. Kenneth S. Pope, Ph.D., identified 21 ethical fallacies used to justify unethical behavior and 9 fallacies in psychological assessment. Cookie cutter psychology. If you fit a personality type that a psychologist read about in his books or learned about elsewhere, he has a big advantage in understanding you over someone without such learning. But if you don't fit a personality type that the psychologist has studied, you will be crammed into a preconceived mold like smashing a square peg into a round hole. This is known as psychologist's fallacy, an erroneous conclusion predicated upon an observer presupposing the universality of his or her own perspective when analyzing human behavior. What is unknown about someone else is filled in with information the analyst knows about him or herself, his or her family, or others he or she is acquainted with. This bias causes the analyst to presuppose knowledge and ability, lack of knowledge and ability, or intent or lack of intent possessed by the client. The psychologist then becomes worse than the average person in understanding you, a thorn in your side. Besides, 22 other types of logical fallacies used in psychology have been identified. Amateur psychology. It's never okay to assume that someone has a particular type of mental condition. Someone volunteering to reveal such information about themselves is a different matter. Also, ordinary people without psychological training or specialized education routinely psychoanalyze people. Here's an example of their psychosomatic warfare. When I speak to somebody or have spoken to somebody, sometimes there was miscommunication. Either the person failed to clarify themselves, my learning disability made me confused, or both. I was then asked if I'm okay or feel okay in a very serious, concerned-sounding tone, as if I'm on drugs, am about to flip out or fall apart. That is extremely condescending, disrespectful, and a sophisticated form of bullying. It's understandable if someone who has benefited from psychiatric help tries to persuade you to seek such treatment. However, people who accuse others of psychological problems often have problems themselves, are hiding something, or are trying to redirect attention away from themselves. Any non-specialist who has never received psychiatric or psychological help and says that you or someone you know needs such treatment harbors ill will. If you have a subscription to the science fiction magazine Psychology Today, cancel it. Thrown into the psychiatric pigsty. As a child, I was radically different, severely learning disabled, and extremely quiet, causing bullying, shunning, and antagonism from classmates. Sometimes I was harassed until I blew up. A couple of judgmental teachers observed these problems and blamed me. No words can even foul language wouldn't be sufficient to describe that. Their suggestion that I see a psychiatrist, I think they should have seen a graveyard, got this whole mess started. Eventually, my father's thinking was previously influenced. Self-centered parents, cold parents. He formerly worked with troubled students in an institution. In an incident where my mother visited the institution, she observed an orderly dragging, that's what she said. I wasn't there. She said she observed an orderly dragging a terrified woman down the hallway by her hair while her nightgown was open, exposing her private parts. As a child, I wrongly supposed that was the way to handle so-called crazy people. Now I clearly see psychiatry's evil. What could have been done, since I couldn't function properly in a regular school setting, would be to attend a special grade school and junior high for disabled students. Instead, I was sent to psychiatrists who prescribed amphetamines, or so-called speed. This helped greatly. However, my being called into the grade school office every day to receive medication unfortunately became public knowledge. Since I became overly excited, combined with knowledge that I was receiving pills, I became known as being hyper on so-called hyper pills. Years later, I was given this medicine to take at lunch. However, I often forgot to take it. Since medication accumulated in my school locker, I once gobbled up every leftover pill at once, which ended disastrously, as you might imagine. Eventually, the medication stopped working altogether after puberty. Even if the medication still worked, dependency on this medication would continually make money for the psych community. This holds true for every condition. Medications prescribed by psychiatrists mask conditions. They don't cure them, never. Fortunately, I escaped high school and attended an alternative program. However, the alternative program's coordinators embraced psychiatric ideology. Once I was talking to myself, and the principal saw me and reported that I was talking to a door. Now, I only talk to windows, walls, and ceilings because they hold a better conversation. I'm just joking. Rather, someone trained in psychiatric principles typically sees a psychiatric problem behind every common scenario. This psychobabble has spilled to parents who've thought that their toddlers were talking to doorknobs when their toddlers were watching themselves speak from the doorknob's reflection. Nobody talks to doors or doorknobs under any circumstance. Adults should be smart enough to figure that out. Stay tuned for part 3.